HealthStreet is both a concept and a place. So as a concept, we are a community engagement program. As a place, we're a brick and mortar place for us, for the community. HealthStreet has 4 pillars. The first one is to assess the needs and concerns of our community. We do that by asking people wherever they are in the community about their health needs and concerns. Secondly, we link people to medical and social services and opportunities for research based on their needs and concerns. Third, also a site for training. We train the next generation of scientists about community engagement. The 4th pillar is to really build trust and be trustworthy partners in the community.
Anyone's free to walk in anytime, Monday and Friday, between the hours of 10 a.m. 4 p.m. If we don't have a community health worker that's available on site to do a health needs assessment, that's all that becoming a HealthStreet member entails. It's just walking through that 15 to 20 minute conversation, talking about your health needs and concerns, just going through different eligibility criteria to be able to participate in research. And after doing so, that's what membership entails. You're a HealthStreet member. You'll be contacted again at 60 days for a follow-up to see if you were able to use any of those resources. If not, maybe what were some of those barriers that didn't let you use those resources. Same thing on 120 days. And then any time that you're eligible for other research studies, we'll give you a call to let you know about that as well.
We started HealthStreet in 1989 at Washington University in St. Louis. And then when I moved to University of Florida, we also began the University of Florida HealthStreet. The outreach program has really developed over this long time. The backbone of our model is the community health worker. The outreach based on community health workers is that we're out in the community every day, even into the evening, and our community health workers are going to bus stops, grocery stores, parking lots, libraries, any place where the community is. And we also have health fairs too. And so we go out every day and we talk to people, get to know them, get to know the community's needs and concerns so that we can build programs to help them.
HealthStreet is a community engagement program of the University of Florida, the Clinical and Translational Science Institute, sponsored by the Department of Epidemiology, to link people from the community who might need the services that we can provide or refer them to, as well as a training site to really hopefully develop some passion about community engagement. Through our pandemic grant, which is a CDC-funded grant to make vaccines and health information on vaccines available in the community, we do go with our mobile health vehicles and they have a nurse inside them. So that's, again, an opportunity. There are other resources that aren't HealthStreet resources, but we're connecting by helping them to go to places like the Mexican consulate to provide health screenings that we provide, but also nurse screenings of cholesterol, blood sugar, and if they would like a vaccine.
In 2020, we began a partnership with the Department of Children and Families to provide Narcan or naloxone as part of our opioid awareness initiative. So our community health workers, anytime that they're out in the community, they're carrying naloxone with them, offering training for people. Seen a lot of success with.
Our workforce here is really awesome. It's diverse. We have people, not only different race, ethnicities, but we have people from all different ranks and all different disciplines. People who are undergrads, graduate students, junior investigators, senior investigators, staff members, and each brings to the team a unique perspective.
I know not a whole lot of people, especially like in more rural areas or far out areas, would have access to any medical or health related institutions or things like that. So in us going to them, I think lets them know that they're being heard, that there's people out there who want to hear about their problems and want to help them out with that. And I think that that's very important and very powerful, especially in today's world.
I have a lot of great conversations in general with community members, and there's often a lot of appreciation for what we do. And so just knowing that I'm able to make an impact, even if it's just in one person's life, that's what keeps me wanting to go back out and keep doing what I do.
In order to achieve equity, you have to understand the unique needs of everyone. Places like HealthStreet exist, but people don't know about it, or people don't take advantage of our resources because there's not the access. Like maybe these people don't have a phone, but somebody else might need a bus pass, and we wouldn't know that unless we ask people the correct questions. It's like an experience like no other to be able to actually work with marginalized communities, hear their voices, and adapt the healthcare system and healthcare access to better fit their needs.
So the clothing closet has a lot of great items for babies and teenagers and men and women. We have been able to start some baby steps of HealthStreet around the country. So we have 6 different sites around the country from California to New York that are also involved with HealthStreet. So they're at different stages of development, but it's just so wonderful to see the growth of HealthStreet.
You can go to our website, healthstreet.program.ufl.edu. Right on the front page, you'll see a little square that says Become a Member. It'll ask you for your name, phone number, email address. We'll go ahead and contact you. You can complete a health needs assessment either in person here at HealthStreet or even via Zoom, whichever is more convenient for you.
People keep me passionate. Everyone has a need. We're here to help with that need. And as long as people have needs, we're going to have HealthStreet.